We now come to the statements. Minister Leadsom.
Mr. Speaker, with permission, I would like to make a statement on the launch of our Pharmacy First service. Pharmacies are at the centre of our communities, an accessible front door to our NHS for millions of people. Alongside general practice, optometry and dentistry, pharmacy is one of the 4 pillars that make up primary care in England. And 4 in 5 people in England live within a 20-minute walk of a community pharmacy. They provide fast, fair and simple access to care and advice for the kinds of illnesses that people suffer from every day. Our constituents can now walk in off the high street whenever it suits them, whether they're at home, at work or visiting somewhere. Our pharmacists are not only conveniently located, but they're also highly skilled professionals with years of training under their belts. The numbers of registered pharmacists in England has grown considerably under this Conservative government, up 61% compared to 2010. But these skilled healthcare professionals still represent a rather untapped resource in our NHS. So this government is bringing forward reforms that will make the most of their expertise, giving people up and down the country a variety of quality care and wise advice quickly and easily, saving them a trip to their GP, freeing up appointments for patients who need GPs most, and driving our plan to cut waiting lists. The benefits are very clear, and that's why this government has consistently taken the decisions that allow community pharmacists to deliver more clinical services and supply more treatments. Whether that be other parts of the NHS referring patients suffering from minor illnesses to community pharmacies for advice and the sale of over-the-counter medicines, or whether it's offering life-saving blood pressure checks in pharmacies, or whether it's making it easier for women to access oral contraception in pharmacies. Madam Deputy Speaker, I'm proud of everything we've accomplished so far. But to unlock our pharmacists' full potential, we need to go further and faster. That's why I'm delighted to inform the House today that we're launching the Pharmacy First service, a personal priority for the Prime Minister, himself the son of a pharmacist. This will give pharmacists the power to supply prescription-only medications, including antibiotics and antivirals, for 7 common conditions: sore throats, earaches, infected insect bites, impetigo, shingles, or minor urinary tract infections in women. More than 10,000 community pharmacies have signed up. That's over 95% of pharmacies in England, which is a brilliant sign of their approval. So next time they're suffering from any of these conditions, most people's first port of call can be a quick trip or a call to their pharmacist. They won't need to see their GP first, they won't need to spend time making an appointment, and they can turn to their pharmacist whenever it suits them. This benefits everyone involved. People get the care they need faster, GPs can focus on more complicated cases, and pharmacists can make better use of their knowledge and skills. This is a common sense reform. Pharmacists see and advise people with these sorts of conditions every day, but we've now enabled them to provide prescription-only medicines where clinically appropriate, so they can help people more easily. And it will all deliver results. So Pharmacy First will make it easier for millions of people to get the care they need on the high street. And together with the expanded blood pressure and contraception service, it will free up as many as 10 million GP appointments. In turn, reducing unnecessary trips to A&E, reducing the pressure on GPs, and driving forward our plan to cut waiting lists for patients. Now, Madam Deputy Speaker, the investment we're putting into Pharmacy First will also level up digital infrastructure in community pharmacies up and down the country, streamlining referrals to and from GPs, giving pharmacists better access to relevant information from patients' GP records, and allowing them to quickly share relevant information in return. Pharmacy First isn't just about delivering care faster, but it can also make care fairer by driving down health inequalities, because there are double the number of pharmacies in the most deprived communities in our country. So getting the right care, the right contraception and the right tests will now be faster and simpler for all those people in our more deprived communities than it ever has been before. Thanks to Pharmacy First, they will be able to take full advantage of their pharmacists' expertise and use them to complement the care they receive from their GP and throughout the NHS. So, Madam Deputy Speaker, Pharmacy First was only made possible through close collaboration with Community Pharmacy England, and I really want to thank them for all the work they've done and will continue to do to support community pharmacies to gear up and deliver this new service for our NHS. Madam Deputy Speaker, we on this side of the House have a clear plan for the NHS, getting patients the care they need faster, making the system simpler for staff and making it fairer for everyone. That is our plan, and I look forward to working with pharmacists up and down the country to deliver today's announcements as we build a brighter future for families right across the country, and I commend this statement to the House.
Shadow Minister Preet Kaur Gill.
Thank you, Madam Deputy Speaker, and I thank the Minister for advance sight of her statement. Let me start by paying tribute to the many organisations that have been involved in preparing for this launch and the thousands of pharmacies across the country who have embraced this initiative. Labour has long been arguing that pharmacists should play a greater role in the NHS, so we support this move. Pharmacies, as the Minister has said, already do far more than just dispense repeat prescriptions and sell shampoo. They are medicine experts within the NHS, they are highly trained, they are easily accessible right across the country, and as we saw during the pandemic, they are a highly trusted part of their communities. But their skills and knowledge are often underutilised. Therefore, bringing more services to British high streets for patients to get treated more quickly and conveniently is absolutely right. It's why, as we announced last week, we want to bring the NHS outpatient appointments closer to people through high street opticians too. The Minister is right to highlight that pharmacists can take pressure off GPs. However, let's be clear, Madam Deputy Speaker, this announcement won't make up for the 1,000 pharmacies which have been closed under the Conservatives or the 2,000 GPs that have been cut since 2015. Patients today are still waiting over a month to see a GP if they can get an appointment at all. And when Labour was last in office, you could get an appointment within 48 hours. That is the thing with this government. It gives with one hand and takes with the other. So can the Minister explain what has happened to the government's pledge to deliver 6,000 more GPs this year? And can she explain what she is doing to support community pharmacies who are already facing a perfect storm of inflationary pressures for running costs, recruitment challenges and an unstable medicines market? Now, the government's press release issued today claims that patients in England will be able to get treatment for 7 common conditions at their high street pharmacy from today. So let's just dig down into whether that is actually the case. Health Watch England has warned it will take time for pharmacists to get trained to actually provide the services ministers have announced. So can the Minister tell us when she will be able to guarantee that the services being advertised are actually going to be available? And let me also ask about IT integration. To facilitate this rollout, pharmacists were supposed to have access to GP Connect so that details of patient consultations would automatically be sent to general practice through the clinical IT systems. The government have had 12 months to get this ready, but from what I'm hearing this morning, this is actually still not live. What pharmacists are telling me, they can only access a summary of GP records. They then have to use another system to input what they've actually prescribed. Then they have to download that and email it across to the GP. That is absolutely cumbersome. So what estimate has the Minister made of the time that is going to be wasted at a local level to address this issue? And how long does she think it will take for the system to be actually ready? And finally, longer term, what is the government's plan to integrate the increase in independent prescribers being trained as part of the long-term workforce plan? And does she agree with us that we should be accelerating the rollout of independent prescribing so that we can establish a community pharmacist prescribing service covering the broad range of common conditions? This will support patients with chronic conditions because this is the big challenge facing the NHS. So does she agree that community pharmacy will have an important role to play in supporting GPs in the management of long-term conditions like hypertension, asthma, and in tackling the serious issue of overprescribing, which is responsible for thousands of avoidable hospital admissions every year? Madam Deputy Speaker, We agree that patients should be able to go to their local pharmacy to receive some services that they currently get at their GP surgeries, like vaccinations free of charge on the NHS, with patients seen faster and GPs freed up to see more complex patients. By bringing healthcare into the community, patients will have greater control. And the NHS should be seen as much as a neighbourhood health service as it is as a national health service, with healthcare on your doorstep, there for you when you need it, and with Labour, it will. Thank you.
Minister.
Thank you, Madam Deputy Speaker. Well, the very first appointment under Pharmacy First happened at 8:30 this morning. Or was it 8:31? Thank you, Secretary of State. So when will the services be available? I should think there's many more taking place already. I'm afraid the Honourable Lady, whilst welcoming this, is being a little bit pusillanimous with her praise, because actually a lot of the suggestions she has made, as she will absolutely know, is simply not true. There are already thousands of new GPs, well over 2,000 GPs who are working in our NHS, and many tens of thousands of nurses working in our NHS, many thousands of additional practice staff working in GP practices. And in fact, as she will know, our brilliant GPs have made available 50 million more appointments each year ahead of our target that was set in our manifesto. So good on them. They're doing an amazingly good job. And what this will do, this new Pharmacy First, is to ease the ever-increasing burden on our GPs. She also talks about the technology, and I'm very pleased to tell her that a key part of the decision on when we could go live was to ensure that the technology was in place. There is a very short window where some systems will have elements of manual intervention, but only for a few weeks, and the whole system will be fully automated. It will provide absolutely the ability to inquire into GP records and to swap advice, which is very important for pharmacists to deliver that excellent service that they're already delivering. And finally, she will also know that community pharmacists for some time now have been delivering blood pressure checks, which in some cases are truly life-saving. This is amazing patient access and patient convenience, and I think that the party opposite should for once simply praise it and be glad that this government has stuck to our plan and got on with it.
Thérèse, Coffey.
Thank you, Madam Deputy Speaker. I'm so pleased to hear this announcement today and that we are delivering. I must admit, in our plan for patients, this was one of the key things I wanted to make sure that happened. And in particular, there are many members in this House, current and past, who have been things like infections, and as a consequence of not dealing with them, have ended up in hospital. And this is a sort of sensible approach, which frankly did meet some resistance from my time at the department, worries about over-prescribing prescriptions, but it's treating pharmacists like proper professionals, but most importantly of all, quicker access to care, necessary care that patients will now properly enjoy.
Minister.
Well, can I say a huge thank you to my right honourable friend for her contribution to kicking this project off. I do feel very fortunate to be here at the dispatch box on the day we launch it, because of course many others were involved with setting this up in the first place. And my right honourable friend is quite right to highlight some of the problems with spotting things like sepsis, infections, which pharmacists are trained to spot, and that really can be the first line of defence. And now being able to walk off the high street into a pharmacist is incredibly valuable to all of us.
Sir George Howarth.
Thank you, Madam Deputy Speaker. As a long-standing supporter of the idea of Pharmacy First, I do welcome the Right Honourable Lady's statement and also welcome the specific reforms she's talked about introducing. She will be aware, however, that pharmacists in my constituency and further afield are very concerned that they're unable to do the job they're already expected to because of lack of capacity and problems in accessing certain drugs that are necessary for them to prescribe. Can she give us some indication of how the problems that already exist are going to be dealt with so that they can then do what is promised for Pharmacy First?
Minister.
I'm grateful to the honourable gentleman for his support for the programme. There are around 14,000 licensed medicines, and the vast majority of them are in good supply. The department works very closely with the sector on finding alternatives and on sourcing supplies for medicines, and most of the time we're able to meet that. Occasionally there are challenges, but that doesn't change in any way the ability of community pharmacists to be the expert medicine suppliers that they are, and to meet the need for treatments and advice from general members of the public.
James Morris.
Madam Deputy Speaker, can I warmly welcome the statement from the Minister? I think this initiative does have the potential to transform primary care and access to treatment. But would she agree with me that in order to realise its full potential, we do need to be investing in new technology? She mentioned digitalisation to make sure that the pharmacies and community pharmacies are set up to take advantage of these new opportunities, and also investment in the pharmacy workforce as part of the government's long-term workforce plan, looking at the alternative roles within pharmacies like pharmacy technicians, so that they have the capacity to take the opportunities that she's outlining today.
Yes, my honourable friend is absolutely right. Investing in technology, as I've set out, is vital, but so too is investing in the workforce. We've seen an increase of 61% in numbers of registered community pharmacists since 2010, and we have plans in our long-term NHS workforce plan to increase that further by 50%, and we're already increasing places, training places for both pharmacists and pharmacy technicians.
Dame Diana Johnson.
Deputy Speaker. Can I too welcome Pharmacy First? I think it's a very good initiative. But I wanted to raise the fact that in my area, we've seen in recent weeks the closure of 2 pharmacies on Beverley Road and on Champlands Avenue. And I'm also told by leaders in the pharmacy community in the Humber that we have one of the largest numbers of temporary closures because of problems accessing pharmacists. So I wondered whether the Minister might look favourably on an idea that I've got to have a school of pharmacy attached to the Hull and York Medical School. We also need a school of dentistry as well. But if we could have a centre of excellence for the Humber area, it might solve some of these workforce problems that we specifically have.
Well, I'm always happy to speak to colleagues across the House on their ideas for new dental pharmacy schools. It's always an ongoing interest. But to her point about pharmacy closures, in fact, in England, we are blessed with huge numbers, well over 10,000 community pharmacies. And in fact, 4 in 5 of us are able to walk to a community pharmacy within 20 minutes. And in the more deprived areas, the numbers of pharmacies are double that in the more well-off areas. So I think we are very well served by our brilliant pharmacists. And I hope that this Pharmacy First programme is actually going to improve their footfall and improve their value in each of our communities.
Sir Bernard Jenkin.
Madam Deputy Speaker, can I very much welcome this initiative to encourage our pharmacies to provide more frontline healthcare for the population, which the population need to know about, because very often they don't think of their pharmacy. But can I also ask what work the government is doing to look at large population centres like Harwich and Dovercourt, which is over 20,000 people, which have no out-of-hours pharmacy cover. So people have to make a round trip of in excess of 40 miles to collect a prescription on a Sunday, for example. Is there any work going on in the government to look at 24/7 coverage of pharmacy for larger population areas?
Well, my right honourable friend raises an important point, and what I can tell him is that pharmacists will keep their community pharmacy open for up to 72 hours, in most cases some for 100 hours, which does mean weekend accessibility. And it's always something we keep under review, but it actually the availability is very good.
Daisy Cooper.
Thank you, Madam Deputy Speaker. Liberal Democrats have long supported calls for Pharmacy First, and the National Pharmacy Association, based in my constituency of St Albans, has been calling for it since at least 2017. So the move is welcome, but it is long overdue. The Minister will be aware that since 2015, there have been almost 700 permanent closures of pharmacies, and the CCA now estimates that there's 8 a week that are closing, including one in my constituency. Could the Minister please say what steps she's taking to make sure there are no more closures this week, next week and every other week this year?
Well, the Honourable Lady might remember that the Liberal Democrats were in government for a good part of that period of time. But she talks about pharmacy closures. We do see pharmacies opening and closing. There have been a small number of net closures, but we are very well served across England and we keep a very close eye on that. But this Pharmacy First is a real new boost to community pharmacies right across England.
Heather Wheeler.
Deputy Speaker, I congratulate my right honourable friend for bringing in this initiative. Really well deserved. I've got fantastic community pharmacies in South Derbyshire. Sadly, when the boundary changes come, I'm going to be losing Hatton to Derbyshire Dales, but they are absolute leaders in their field and so trusted in their communities. So this is a brilliant initiative, and I can't thank my right honourable friend enough. Thank you.
Thank you to my honourable friend.
Order. That was a perfect answer. I have to tell the House that we have a lot of business to get through today, and therefore I'm going to need short questions and admirably short answers. Otherwise, not everyone who's standing will have a chance to ask a question. Barry Sherman.
Deputy Speaker, can I say that I don't agree with most of the things that the Minister said today. We're all in favour of pharmacies. I think this statement today is a distraction away from the real problems in our health service, in our GP service and much else.
Will the honourable gentleman please ask a question?
The question I have is, has she looked at the number of pharmacies that have closed down in the most difficult areas, the poorest areas of our country? And lastly, what's she going to do about people like Boots that have even closed the local Boots in Westminster?
Thank you. Order, order. I allow the honourable gentleman, because of his seniority, a little more leeway. One question, one answer. Minister.
The more deprived parts of England are much better served with community pharmacies than the better well-off areas.
Dean Russell.
Thank you, Madam Deputy Speaker. In Watford, we have amazing pharmacists and community pharmacists, something I've been championing in support of organisations like Sigma, a fantastic local business. Can I just get reassurances that the general public will be made massively aware of this new fantastic new service? Thank you.
Yes, there will be a significant communications package beginning today.
Ben Bradshaw.
She doesn't appear concerned about the record number of community pharmacy closures under this Conservative government. Why does she think it's happening?
There's a 61% increase in registered pharmacists since 2010, with plans to recruit to increase that number by 50% in the next few years.
Preet Patel.
Deputy Speaker, I commend my friend for her excellent statement, but may I ask her how she will tackle the issue of funding for prescriptions with community pharmacies? They themselves are struggling, and she will understand that the NHS tariff is not actually paying the pharmacies the full price of the products. And is this something that she will look at as she rolls this scheme out?
The government currently contributes £2.6 billion to community pharmacy, quite apart from the £645 million addition for Pharmacy First. We're about to start the negotiations for the 24-25 period.
Sarah Jones.
Thank you, Madam Deputy Speaker. I have 3 pharmacies in Shirley, in part of my constituency. They've all been there for literally decades. They're very well known, very trusted. They are all on the edge of having to close. One of them is using their own savings and not paying themselves wages to kind of keep open. Welcome what you're announcing today. Would you read a letter from them on...
Order, just because at other times there's been lax obeying of rules, would the Honourable Lady please refer to the Minister as she, not you? Please.
Forgive me, Madam Deputy Speaker, that was an error. Would the Minister read a letter from them and potentially look at some of those issues, perhaps meet with us to talk about them, because they are good people and we want to keep those open?
I'm, of course, happy to read the letter, but I would say to her, Pharmacy First offers a significant new boost to community pharmacies.
Timson.
Madam Deputy Speaker. My right honourable friend will be pleased to hear that across Cheshire and Merseyside, 535 community pharmacies will be starting the Pharmacy First initiative today, including in my Edgbaston constituency, where particularly in rural areas it's such a lifeline for many people. But can my right honourable friend reassure both patients about the clinical competence of pharmacists to carry out these other prescriptions, but also reassure pharmacists on the issue of clinical liability?
I can assure my honourable friend that pharmacists are highly skilled, higher trained than ever before in this country now, and they are fully equipped to meet the demands of their new prescribing role.
Mr. Speaker, I welcome this Pharmacy First initiative. It's long been overdue to be rolled out, but what expectations are we creating in the minds of patients when they attend pharmacies? Are pharmacists going to be trained in denying some medication when people turn up expecting to be given a prescription of some sort? Because clearly this is going to encourage more people to present in order to get medication than otherwise may be necessary.
The honourable gentleman raises a good point. Of course, pharmacists will be prescribing for 7 common conditions. There will be plenty of referrals made to GPs and from GPs to pharmacists to give patients the accessibility but also the appropriate level of assessment of their needs.
Jeremy Quinn.
Pharmacists in Horsham have asked for such a scheme. They will very much welcome it, as certainly do I. But as the Minister is aware from our one-on-one discussions, for which I'm grateful, there are issues of access to pharmacists currently in Horsham. Will she ensure that the sector is appropriately resourced and has the right training to ensure that this is the great success that it deserves to be?
Absolutely, and I'm always happy to discuss it with him further.
Jim Shannon.
Madam Deputy Speaker, thank the Minister very much for that answer. In Northern Ireland, we currently run what was the minor ailment scheme, and what is now called Pharmacy First is acknowledging that GPs can spend up to 40% of their time, of their working day, on minor ailments. However, the scale is difficult to what has been proposed in England. Will the capacity, Minister, for this to be rolled out UK-wide to take pressure off our GP services? Because if it does, that's the right thing.
Well, I seriously look forward to the re-establishment of the Stormont Assembly so that it will be possible for Northern Ireland to implement such a scheme themselves.
Robert Buckland.
Deputy Speaker, I warmly welcome the statement. I've been a strong champion of pharmacies in my constituency. We are experiencing challenges, though, when the likes of Boots withdraw services. It's very difficult to transfer or apply for licences, despite the fact we have a number of very keen applicants who want to provide important pharmacy services. What more can the government do to speed up and make that licensing application procedure smoother and better?
I'd love to hear more about that from my right honourable friend, and I'll be happy to look into it.
Nina Wilson.
Thank you, Madam Deputy Speaker. In recent months, Boots has closed 2 out of 3 pharmacies in the Hampton area in my constituency. This has left Hampton North, which is one of the most deprived wards in the London Borough of Richmond, without a single pharmacy, with elderly residents and those with long-term conditions having to walk a lot further than 20 minutes to be able to access a pharmacy. And local GPs tell me it's just not viable to set up a community pharmacy facility. So will the government review the pressures on community pharmacy and look at the community pharmacy contractual framework so that we can make this initiative work and take the pressure off GPs? Well done.
There are, as I've already mentioned, many community pharmacies starting up all the time, as well as closing down. The Honourable Lady will appreciate that the Pharmacy First initiative is a real boost to community pharmacies, and I'm happy to discuss it with her, but I would imagine that there will be the capability to open new community pharmacies in her area.
Can I congratulate my right honourable friend on the front bench for rolling this out? The Island of Portland has 2, or did have 2 pharmacies, both run by Boots. One's now shut. Can I meet my royal friend and the front bench to discuss how we can ensure that deprived areas like Portland retain the pharmacies that they desperately need?
I'll be very happy to meet with him.
Alistair Strathern.
Thank you, Madam Deputy Speaker. With so many constituents in my area waiting a long time to see GPs, any boost to primary care capacity has to be welcomed, and I thank the Minister for today's announcement. But with GPs and pharmacies I'm meeting with raising real concerns about recruiting to open roles at the moment, What assurances can the Minister offer that this won't be, following the childcare announcement, another policy that lacks a workforce or sectoral strategy to really make full of the benefits?
Well, as the Honourable Gentleman will know, that our NHS long-term workforce plan intends to increase by 50% the number of registered pharmacists that there are today, and that work is underway now and includes increasing the number of pharmacy technicians too.
Ford. It's great that people will be able to go to the pharmacy for the prescription as well as the product they need and thus not need to go to the GP. In Chelmsford, I have some great community pharmacies, but Boots are closing 3 branches. So please will she meet with me to make sure that the people of Chelmsford will be able to get to the pharmacy that they need for this to work.
I'll be very happy to meet with my right honourable friend.
Thank you very much, Madam Deputy Speaker. In the community pharmacy in Wem, in my constituency, they have struggled to find a full-time pharmacist, relying instead on locums. That means the opening times are erratic, people can't rely on it, and the pharmacy is loss-making because the locums are so expensive. Could the Minister elaborate on how she will help pharmacists in rural areas recruit the full-time pharmacists they need and reduce their reliance on locums?
The Honourable Lady will be aware that community pharmacies are normally private businesses. There's a few owned by GP practices, but on the whole, they're private businesses. We are training the registered community pharmacists that we need, and it will be obviously for that local area to be able to put in place their own recruitment policies, but I'll be happy to meet with her and discuss it further.
Sherilyn McCrory.
Thank you, Madam Deputy Speaker. I warmly welcome my right honourable friend's statement today. And can I put on thanks my thanks to all of the pharmacists that work in my constituency of Truro and Falmouth. Would she agree to meet with me, though? Because given the geography of my constituency, often someone's nearest pharmacy, which is about 1.5 miles away, is across the water, and actually they end up having to drive about 11 miles round to get to that pharmacy. Would she look at the mapping for me, which I believe needs to be changed, but it'll take a meeting to do that. Thank you.
Always happy to meet with my honourable friend. Just to let her know, there are 100 pharmacists signed up to Pharmacy First in Cornwall.
Paul Bristow.
This brilliant announcement has the potential to free up many thousands of GP places in places like Peterborough. But this will only be the success we need if more people know about it. She touched on an awareness campaign, but what efforts will she make to ensure that that awareness campaign reaches difficult to reach communities, such as those with English as an additional language?
Well, there will be a big communications plan. Happy to share it with my honourable friend. There are well over 100 community pharmacies in his area who've signed up to Pharmacy First, which is brilliant news. But I do think that it is incumbent on all of us, hence the purpose of the statement today, to make sure our constituents know about this excellent new service.
Michael Fabricant.
Although my right honourable friends and I share a common scepticism about the sclerotic state of the European Union, there are lessons to be learned from Europe, and I'm glad to see that, like France, we're now really respecting community pharmacies. Can I ask, however, one specific question? In her statement, she said that one of the areas where the pharmacy can act is with female urinary tract infections. Why not male?
Well, happy Brexit Day to my honourable friend. I will have to come back to him on that issue. The point is that it is limited to minor urinary tract infections. That might be the reason why not men, but I will certainly get back to him on that point.
Dr. Ben Spencer.
Speaker, I, along with many of my constituents, not all of them in Reading, Mead and Weybridge, will very warmly welcome the statement today. My question is about integration with other NHS access services. If an individual was to dial NHS 111 with one of these conditions that have been announced today, would they be diverted to pharmacy or to GP first?
It would actually be to the pharmacy. So 111, GPs and UEC can all refer to pharmacists for those particular common conditions.
James Wilde.
Thank you, Madam Deputy Speaker. I join the welcome for this new scheme. And as part of the communications, will my right honourable friend ensure that the NHS website is updated to show which pharmacies are signed up to Pharmacy First? And will she continue to encourage others that haven't done so far to do so?
Well, what's brilliant is that over 95% of all community pharmacies have signed up, including 172 in his own area.
Nigel Mills.
The key to this service being successful is when patients try it, the pharmacy can actually offer the service when they turn up. So does she know how many actual individual pharmacists have been trained to provide these services? And is there a way of gathering data and publishing when actually pharmacies are offering the service so a patient won't have a frustrated journey and we can see where the gaps are that need filling?
So, as I say, more than 95% of all community pharmacies have signed up to the service, and all pharmacists have been trained in how to deliver it.
Steve Double.
Thank you very much, Mr. Speaker. As someone who has championed the role of community pharmacies throughout my time in this House, I warmly welcome today's statement. I'm particularly delighted that we were able to host one of the pilot schemes in Cornwall that was hugely successful, resulted in 7,500 consultations, which took 6,000 appointments away from GPs and 75 A&E appearances. So would the Minister join me in thanking all the pharmacies in Cornwall who took part in the pilot, which was so successful?
Absolutely. It's only by trying these things that we can see how successful it can be, and I do believe this is going to radically improve patient access to care.
Right, that completes statement. We now come to the next statement. I'll just let the front bench clear.